Hi, I'm Dr. Joe Anderson, and I'd like to thank the ASGE for allowing us to present our data in this unique format. The title of our talk is A Larger Proportion of Significant Adenomas Present as Flat and Proximal in Women as Compared to Men, a prospective screening study using a high-definition colonoscope. This study was performed by myself and my fellow Maria Soriano Johnson. We know that interval cancers may occur more frequently in the proximal colon and in women. Furthermore, men and women have a similar lifetime risk for colon cancer, despite the multiple studies that have shown that men have more advanced adenomas. One explanation may be that women are more likely to have flat adenomas, which are more difficult to detect. Thus far, no data exists regarding a gender difference in risk factors associated with adenomas presenting as flat and proximal in location. This is a diagram showing the differences between flat and protruding. We break adenomas down into flat and protruding depending upon their height. The goal of our study was to examine the difference between men and women with respect to the morphological and anatomical presentation of advanced adenomas, and those adenomas greater than 6 millimeters in size. We examined the colons of 600 consenting patients. We performed what I considered the state-of-the-art colonoscopy on those patients at the time. 8-minute withdrawal time, a prototype high-resolution colonoscope was used. We used indigo carmine whenever necessary. All polyps were snared and retrieved for histology, photo-documented for further and subsequent documentation. Large polyps were removed with EMR for complete pathology. This was the form that was used to collect demographic as well as family history, smoking history, and other lifestyle information, medications, as well as the endoscopic results. We had 600 patients. It was a relatively diverse population, mostly women, 350 women. Less than half of the women were Caucasian. Overall, 30% of the population was Hispanic. It was an overweight population, about 30% were obese, and it was a relatively young population, median age of 56. When you looked at the adenomas overall, this is looking at total adenomas, not per patient but per polyp. You'll see that men have more polyps than women, but when you look at that blue bar, women were more likely to have their adenomas present as flat lesions. The target population, or the outcome that we were looking at, were these red lesions, the flat proximal lesions, as opposed to all other lesions, as opposed to the green lesions, the protruding distal and proximal, as well as the flat proximal. So when you looked at these flat lesions, lesions were more likely to present as flat in women than in men. Adenomas were also likely to present as flat and proximal in women as opposed to men. And when you looked at the overall age-adjusted OR, presenting polyps were more likely to be flat and proximal in women as opposed to men, with an odds ratio of 2.6. When you looked at advanced adenomas, we found a similar relationship in that advanced adenomas were more likely to present as flat and proximal in women than in men. So the conclusion of our study were that adenomas greater than 6 millimeters were more likely to present as flat in women. In addition, adenomas that were advanced were also more likely to present as flat in women, plus they were more likely to be proximal. These data may explain why there are fewer identified adenomas in women than in men, yet a similar number of colorectal cancers in the genders. Specifically, flat lesions may be more likely to be present in women and missed, and thus develop into cancer, giving us different number of advanced adenomas within the gender, but similar rates of colon cancer. We hope that our studies will spur other studies to examine the similar issue, as well as potentially have endoscopists be more careful in the proximal colon of women. Thank you for your attention.